Hey guys, so I've talked with a lot of thyroid patients over the years, and one of the hallmarks is if they've been diagnosed with a thyroid disease, they're told, you have a thyroid problem, you have to take this medication, here you go. They're not told what the thyroid does, they're not told how the thyroid actually works in the body. So I want to give you guys just a real brief physiology background. I want to teach you how your thyroid functions in the body and why it's so important. So first thing I need you to do is get a pen and paper, multiple color, just kidding. You don't have to write anything, you're watching me on video. It's really, really simple. I'm going to give you just a couple little pointers here, okay? Everything starts in your brain. Your thyroid sends a signal from the brain, actually, I should say the hypothalamus sends a signal from the brain to the pituitary gland to actually make a hormone. You've heard of this hormone, it's called TSH, thyroid stimulating hormone. Once the pituitary gland sends that TSH to the thyroid gland, then the thyroid is told to make two hormones, T4 and T3. 93% of what the body makes is T4. Only 7% is T3. So the key thing is, if you're taking Synthroid or levothyroxine, that's a synthetic T4. So what you're taking is many times the same type of product that your body is making. But here's the caveat. Your body doesn't use T4. I want you to digest that. T4 is made, but the body can't use it. It has to be transported away from the thyroid gland to peripheral tissues, and then it has to be converted from T4 into T3. So just because you have enough thyroid hormone, or more importantly, you're taking Synthroid or Levoxyl or another medication, and your doctor says your levels are normal, doesn't mean your body is using that thyroid hormone properly. 60% of T4 to T3 conversion occurs in the liver. When's the last time they checked your liver enzymes? If they're elevated, you're going to have a problem with that. I can tell you, liver enzymes don't get elevated until there's actual damage to the liver. You can have dysfunction long before that. If you have hormonal imbalances, if your estrogen levels or testosterone levels are off, how about progesterone levels are off? If you have issues digesting food, you probably have a liver problem. If you have energy problems with B12, you probably have a liver problem, which means that you can't convert T4 into T3. 20% of that conversion occurs in the gut. So if you have a gut problem, you're going to have problems converting T4 into T3 and your thyroid's going to be affected. 20% occurs in other tissues. So you need to have your body functioning as a whole piece in order to have your thyroid converting that T4 into T3. Now, here's the thing. Once it's converted, it still has to be transported to cells where it's used. You know, every cell in the body uses T3. So it has to hop in a taxi cab called thyroid binding globulin, get sent to the cells, and the cells still have to use it. If you have thyroid symptoms, if you are on birth control or hormone replacement therapy or have severe adrenal stress or even insulin resistance or blood sugar problems, your body may have a resistance against using thyroid hormones. If that happens, then when that T3 gets to the cell, it's not going to be used and you're still going to have symptom problems. When you're tested by your doctor, they look at TSH. Why aren't they checking free T3 to see what your body is converting? Why aren't they checking free T4 to see what your body is able to convert from? Why aren't they checking T3 uptake to see why your body can use T3? They have to look at all the tests if they're going to figure out why you have symptoms. And at the end of the day, there's some new standards that have been put in place where all they care about is TSH. That is a problem because they're not looking to how the hormone is working. They're literally just looking to see if you need to be on a different medication level. If you're going to get better, you need to understand this process and demand more out of your doctors, or better yet, come see me, Dr. Green, and let me help you. 704-987-3993 is my office number. Come and visit one of our workshops that we have in the office. Look me up online, or more importantly, just schedule an initial consult with me. Thank you.